Today we're going to have a quick look at the brachial plexus. This is one of the most common images I'm asked to draw and teach. So start by drawing 3 horizontal lines, the middle one shorter than the other 2. And then we add in 2 landmarks. So I like to add in the clavicle and the first rib. We add the roots C5, 6, 7, 8 and T1. C5 and 6 form the upper trunk, C7 is the middle trunk, and C8 and T1 form the lower trunk. I then add in the long thoracic nerve, which comes from 5, 6 and 7. The next step is to add in the divisions. So each trunk has an anterior and a posterior division. The posterior division of the upper trunk, middle trunk and lower trunk form the posterior chord. The anterior division of the upper trunk and the anterior division of the middle trunk form the lateral chord, and the anterior division of the lower trunk forms the medial chord. Next we add in the median nerve, so I like to remember median is in the middle. This comes from the lateral chord and the medial chord. That's the median nerve. Then draw in a snake's tongue. This is where the posterior chord becomes the axillary and the radial nerves. The lateral chord, we then add in, on this side, I like to put my image up against my arm and then you can see which nerves they are. So on the outside is musculocutanous and on this side you can see it lines with your little finger. So that's ulnar. So they're your main 5 nerves, and then we'll add in a few branches just because we can. So we have lateral pec, which normally has a medial pec from the medial chord. And then we have the medial cutaneous nerve of the arm and the medial cutaneous nerve of the forearm. And then from the posterior chord, we have thoracodorsal. Dorsal and posterior mean the same thing pretty much. And then from somewhere up here, we have suprascapular, which comes off. And that's relevant as if you do something like a supraclavicular block or an infraclavicular block, you're likely to miss the suprascapular nerve, and that supplies the skin of your shoulder. So that is needed to be blocked for shoulder surgery.